SNIP-AFRICA is basically a partnership between some European partners, but also importantly some African partners. What it aims to achieve is really to create a platform that will allow us to address lots of important questions that have already been identified, and questions yet to be identified about how to manage neonatal sepsis or severe neonatal infections. The difficulties around managing neonatal sepsis are many, starting with identifying it, which can be quite challenging. We're particularly worried about rising levels of antimicrobial resistance in the bacteria that we know are causing neonatal infections in low and middle income countries and including in lots of sub-Saharan African settings. We know that this is a problem, for example, from recent work done by the Global Burden of Disease Initiative that has been published in 2022, and that shows that in fact the impact of antimicrobial resistance is expected to be highest in the neonatal group. So in the context of that information, it becomes very important to address how antibiotics should be used to manage these babies, particularly those babies who need admission to hospital and are likely to be sickest. Traditionally, the way that we've done research is to fund a trial. We start the trial, we conduct the trial, we finish the trial, and we produce some output from that. But the problem is that there's a lot of know-how and capacity that actually gets built up during the conduct of such a trial that typically then tends to be lost. SNIP-AFRICA really tries to build a platform that will make sure that any know-how and capacity built in any research activities related to antibiotic management of neonatal infections will be accessible to everyone who does any research on the platform now and in the future. I'm hoping that we will generate some interesting findings in the short term that will be meaningful to the patient group that we are focusing on. But I think in the slightly longer run, what I am hoping that we will find ways of adding research activities that we currently haven't envisaged to that platform and make that architecture, or that infrastructure, that framework available to the current group of collaborators, but also partners in the future, so that we can address additional research questions.